Spotlighting Hawaii's leaders.
We want to bring in Governor David E.
Good morning, Mr. Mayor.
Lieutenant Governor, good morning. Thanks so much for joining us. Mayor Derek Kawakami.
Thank you so much, Senator, for being here.
Spotlighting the issues.
Where is the virus right now in our community?
How much is this overall going to cost the state?
How are you responding to the community's concerns? Talk about the level of citations that you guys are writing.
Spotlight Hawaii with Yunji Denise and Ryan Kalei Suji on the digital platforms of the Honolulu Star-Advertiser.
This episode of Spotlight Hawaii is brought to you by Long's Drugs and Beachside Roofing.
Aloha, happy Monday. Thank you so much for joining us here on Spotlight Hawaii. We ran a little bit late this morning because we were waiting for the governor to finish his State of the State address. We're going to talk about that address and what he talked about in a future episode. But today, Ryan, we are focused on the pandemic and really diving deep into what's happening in our hospital.
That's right. We're going to be speaking with someone who has been on the show a number of times, and really all of our conversations have ranged from the beginning of the pandemic of where we were back then. And of course, she has helped navigate those experiences over the past 2 years with us. We're welcoming in Dr. Melinda Ashton from Hawaii Pacific Health. Thank you so much for joining us this morning, Doctor.
Thank you. Good morning.
Good morning. Let's start off with where we're at and what you're seeing right now at the hospitals of Hawaii Pacific Health. We know that a large indicator, as the governor has mentioned in press conferences in the past, will be the hospital capacity. What we see in the hospitals could actually help determine what happens and what regulations are then set in place by the state. What are the hospitals looking like right now?
Right now, our hospitals at Hawaii Pacific Health are busy. We have been busy for several weeks. And the hospitals across the state are also busy. But we are not busier this week or today than we were last week. It looks like things may be stable, perhaps, and a slow increase at our hospitals in the number of patients with COVID. The good news is the patients with COVID are not taking up a lot of the ICU capacity, and they are not a lot of them on ventilators. So all of the things that we know about Omicron, that it doesn't seem to be as much of a lung problem, are holding true so far. Now, there are a few people who are on ventilators and who are quite sick and, sort of fit into the more classic mold of what we've seen with COVID. But our hospitals are very busy, but it's not all COVID is basically the bottom line.
That's good news. Let's talk a little bit about kids. We know that you're also a pediatrician. How is this virus, from where you're seeing, affecting children right now?
Yeah, we were quite concerned, hearing stories from the mainland about children's hospitals being very busy with COVID patients. That has not been the case here. And every day now, when we meet with the Healthcare Association and talk about, patients across the state, we've been reporting in pediatric admissions for weeks. And rarely is there a pediatric admission at any hospital other than Kapiolani, where they're, commonly taken across the state, and then occasionally at Tripler and at Kaiser. But the total number has not been what we were thinking we might see. So we generally see a handful of children. Many of them are kids who are fragile, who require a lot of health care, and something like a viral infection, regardless of what it is, will tip them over the edge and have them require hospital care. So that's pretty common. We're not seeing children who, again, are otherwise healthy, who end up in the ICU because of a COVID infection. At least that would be a really rare event for us.
And to expand a little bit more on the pediatric cases, have you seen that because of the percentage of those keiki in our community that are vaccinated, that has helped? And how much of an impact do you think the vaccination amongst keiki in the community has impacted what you're seeing in these hospitals?
It's really hard to tell. We check on vaccination status of the children that are in the hospital, as we do the adults as well. And in general, those who are vaccinated are not represented in those hospital numbers the same way that they would be in the population. And so we're seeing among the children that come in, generally they're not vaccinated, not entirely. Occasionally those really fragile kids have had some vaccine doses. But for the most part, those are children from families that have chosen not to avail themselves of the vaccine if they're eligible. Now, of course, we have the kids under 5 that aren't eligible. And so we see some of them as well.
Let's talk about the people who are ending up in the hospital. We know that you said that unlike the Delta surge, you're not seeing as many folks in ICU beds, but the people who are coming in who need the longer care, what kind of symptoms are they presenting, and what are you seeing in those patients?
Yeah, it varies. The unvaccinated patients that we see can still just have comorbidities, so they can be very obese or have significant diabetes or heart disease or something else that with COVID puts them into the intensive care unit. There are a few that are still very much like the old COVID that we saw under Delta and before, that actually require a lot of ventilator care, but not many. And then the other group that we're seeing are vaccinated and even boosted seniors and super seniors. So 75 plus, 90-year-old. We're seeing, significantly older people who are also impacted with lots of other conditions. So we see people who are otherwise bedridden who end up with COVID, who then end up in the hospital requiring care.
When we look at, of course, just the personnel of the medical personnel that have been treating COVID-19, I mean, it has been a long 2.5 years as we've battled through this, and it has taken its toll on many of those who work in this medical profession. What have you seen from the employees that work in your hospital? How are they dealing with this latest surge, and what other assistance are they getting from any outside, medical help that may be coming to support them?
Right. Yeah. We, like the rest of the community, when Omicron started to mid-December, we saw a number of our employees, clinical as well as not clinical, infected or having family members who were infected. And so that greatly impacted our ability to fully staff as we would normally. So we have been dealing with that, although that seems to have settled down a good bit. And also, over this last couple of years of the pandemic, like other industries, we've seen a lot of people decide that this isn't the work they want to do. And so the Great Resignation has certainly included healthcare workers as well. It's also meant that there are some people who, have lived in Hawaii for quite some time, but made the decision that they need to be closer to family on the mainland. There's a whole lot of dynamic there, but certainly we have positions open that we would like to fill, and difficulty finding people to fill those. That said, our staff are amazing, and they've just done a really good job. And I was hearing today in our report out that the mood at our hospitals is one of, hey, we've got this. We're in, we can take care of things. We're going to manage. And with the additional staff that we've received FEMA funding for, that just makes that little bit of a difference, so that in the emergency department or the ICU or on the medical surgical floors, we have just a few extra helpers, and that makes a difference as well. So I think, amazingly, our staff is coping just fine. And they're, like everybody else, they're tired of this. They want it to be over. But, continue to come to work and do the good work that we always try to do.
Can you talk a little bit about the neighbor island facilities and how you understand they're managing this? Of course, their resources are a lot more limited than what we have here on Oahu. And if Oahu is getting fuller, then it, kind of becomes more difficult for them. So what's the dynamic that you're seeing there right now?
Right. Again, we have a daily call of where all of the hospitals across the state report in. And I think we began to be a bit more worried about neighbor island facilities a week or 10 days ago as their numbers started to go up. But again, they seem to be doing okay. They also received some staff support from, with payment from FEMA, or at least anticipated payment from FEMA. And so that's good news for them. And people have reported in that has helped a lot. But we haven't seen an exponential rise, and people seem to be managing okay. So that was the tenor of the call today was, yeah, we're okay. We're okay today.
Of course, during the vaccine rollout, Hawaii Pacific Health played a major role in that, in helping to get that vaccine out into the community. We saw that blue bus that was all around town at various spots in high schools and schools throughout the the islands, really just helping to provide that access. In terms of the vaccine as well as the booster, what is Hawaii Pacific Health doing, I guess, at this point in time to help push that along? And have you seen any significant uptick in the booster shots as the state continues to push for this?
Yeah, our buses are still out there. We actually have 3 buses, and we're still out at schools and other community locations pretty much 7 days a week if there's, a site to be at. We also have 2 fixed vaccine sites on Oahu and 1 on Kauai. And, we continue to see people coming in for vaccine doses. We see several weeks ago, we were pleased because we began to see a few more first doses of people coming in, and then the booster traffic has been pretty steady. Maybe a week or so ago, it began to drift down again, but I think we're still seeing plenty of interest in our vaccine locations anyway. And so I think that the state rate of boosters should be improving. And I think there's a data problem there that's being reported by the Department of Health. So it may be that our booster rate is better than what we publicly acknowledge.
There's a question here from someone who is a parent and saying, are the numbers for children at a comfortable enough level to allow parents or grandparents and guardians to be spectators at kids' sporting events or other extracurricular activities? I know this is more of a policy question, but since you're a pediatrician, what are you advising your patients in terms of family gatherings and what is safe and what is not? Because it does feel like we're in this strange limbo where we know that things aren't good. We know that Omicron is what feels like everywhere. And at the same time, there's not a push from government right now to, limit gathering sizes and what have you. So how are you advising families to navigate this time, especially those who have very young children?
Right. So I think the reason there's no policy push to restrict anything is that the feeling is, and I think it's borne in data, that those restrictions probably won't have much benefit. So really, it does come down to individual decisions by families, right? And how to decide to navigate sort of the circumstances that they want to be in. And so if it's an outdoor sporting event, outdoors safe, and I think what I recommend to my families is make sure everybody that can be vaccinated is vaccinated. Make sure that you're up to date, and up to date means 5 months since the second dose of an mRNA vaccine, and then you get a booster if it's 5 months or more. And so if you can surround the youngest children and the more vulnerable with everybody else being vaccinated, if you're doing things outdoors, I truly believe that is as safe as it gets, and you probably should do those things. It's been a very long time that we've been restricting ourselves, and it seems to me that we have to understand what is safe and what isn't. Now, if you're going to be sitting in a packed, screaming crowd in an indoor location with people that you don't really have any confidence might be vaccinated, I might be more careful. When I see, the huge crowds at NFL sports things over the weekend, I worry that is a perfect setup for spread. But all you can do is make sure you're vaccinated yourself, that you're vaccinated, the people that are around you are vaccinated if they can be, and the youngest children are just surrounded in that. The mask wearing, good idea if you're inside, absolutely required anyway. And maybe less mask wearing is okay in Hawaii. I see a lot of people still walking outside by themselves with no one around them, still wearing masks, and that probably isn't necessary.
Speaking of masks, there seems to be some sort of little conflict in messaging. Of course, we hear from the CDC about the encouragement of wearing some of these higher grade masks, the KN95s, and we're seeing just the scarcity of them now online and people being able to purchase them. But then also hearing of the impacts of Omicron and maybe the less severe symptoms. I mean, how do people out there navigate through this? And what would you recommend in terms of mask wearing for those individuals out there who feel like they need to have that higher quality grade?
Yeah, I think that the science behind the N95 mask or a KN94, whatever, those higher intensity masks is decent science, but it's not necessarily been put into context in the community and in the way that I would think is reasonable. So I was not a fan of the CDC's announcement that people should be seeking higher quality masks. I think we should be putting the mask wearing into context with everything else. You know, if you're fully vaccinated, if you're outdoors, if you're a young child, N95 is not the answer. We use N95s in the hospital setting or in the healthcare setting when we know that there's an airborne infection that we have to protect the worker from. And so TB is a good example. But in order to get that 95% filtration, you actually have to do fit testing to make sure that mask fits properly. And then you have to do a medical evaluation to make sure that worker can actually tolerate that mask for a period of time. And since none of that's happening in the public, I actually worry a little bit about this message that you have to have this ultrafiltration kind of situation. I actually think, and there was science behind this as well, that if you wear the standard surgical mask that we all see, you know, on sale in the grocery stores and Costco and wherever, and then wear that tightly fitting, you can loop the, or tie the ear ties so that it's tighter, and then you put a cloth covering over that, fits better for many and actually provides really good protection. So I would like to see people doing more of that. And the reason for all of this is because Omicron spreads very, very well, right? And so the idea is if it spreads very, very well, then you want to protect yourself from it by wearing, you know, a really exceptionally good mask. But I'm sure you see it. I see it a lot. That people wearing those KN94s or N95 versions, but they don't fit. And so they've got a gap under their chin and they've got a gap around their nose. They've got ear loops instead of, you know, the more secure fittings. And so those are not going to provide 95% protection or filtration. And so I think we're kidding ourselves a little bit and making people a little bit more worried than they need to be, spending more money than they should on masks.
Oh, that's very interesting. I like the idea of the double layering because we certainly have plenty of that available to us right away. Right. I want to ask you about long COVID and kids, since you are a pediatrician, and there are some questions about long COVID right now. Right. We know that has been happening in adults, but have you seen that in children, and how does that present?
Right. Long COVID in kids is a known entity. We don't yet know about Omicron and long COVID. And so that's an open question. We know that for many, Omicron is milder, and so potentially there might be a difference in long COVID. But we also know that for many people with earlier variants, Delta and before, that you didn't even need to be sick initially with COVID to have long COVID. So in children, it can look quite similar to adults. Sometimes they're just really tired. For much longer than you would expect after viral illness. Sometimes they can't concentrate in school, or they're not up to their usual sports activities. So it may be that. And then they may just be grumpier than usual, or just kind of just not feeling well. And so it's very nonspecific. I think it's easier for adults to explain what doesn't feel good than for many kids. But so it's an open question about Omicron and whether we're going to see long COVID after Omicron. There's a pretty good suspicion that we will, but it is certainly a known entity.
What would you say to those also parents out there who still are a little hesitant about sending their kids to school? We're seeing these numbers that are coming in from the schools. Some of them obviously having bigger clusters than others, and some we're not really sure because of the reporting. What is your message, I guess, to parents out there who may be worried about sending their children into this environment?
Yeah, it's a difficult thing for parents to navigate. There's no question about it. We are seeing, with the quarantine protocols and other things that schools have been using, that a lot of the absences are actually driven by an exposure at school. One of my staff has twins, and she had to have them home for 2 weeks, and they went back for 1 day, and then there's another exposure, and now they're out for another 2 weeks. So it's very difficult and frustrating. The idea would be get your kids vaccinated if you can. the DOE has now better quarantine and exposure protocols than they had several weeks ago. And so hopefully that's shortening some of this missing school. But the most important thing is school is really important for kids. And we know that the remote learning just didn't work as well for many, many children. And so everything we can do to keep kids in school is really what we should be doing.
I want to get back to our conversation at the beginning. You were saying that it seems like things are holding steady, at least from the hospital's perspective. We know we had Dr. Libby Char here on Friday, and she said that the cases were still sort of marching up. She didn't quite want to say that we were at a plateau yet, although she was hopeful that that would happen relatively soon. But we know with COVID, there can be a lag between hospitalizations and case counts. So how much longer do you expect this stress on the hospital to the hospitals, not just Hawaii Pacific Health, but sort of the statewide system overall? And do you think we can weather that?
I do think we can weather it. I think we're in for several more weeks, and I'm maybe a little more optimistic than Dr. Char, or maybe we've had 3 more days of numbers, but it really looks like the numbers have at least plateaued, right? And we know that they have data lags and data sort of catch ups and things, and so we might see a big number tomorrow, but it feels like we're plateauing or maybe starting to go down. And part of the reason I say that is at Hawaii Pacific Health, we have drive-up testing locations, we have urgent care centers, we have emergency departments, and all of those places were crazy busy several weeks ago with people just desperate to get tested. And in the last 7 to 10 days, that's dropped off, and it's dropped off quite quickly. So that would indicate that there are less people out there seeking testing. And so that should then mean that the numbers plateau. And but we do know that the hospitalizations probably will take a week or more to peak, maybe 2 weeks. And then because people stay in hospital for a while, it'll take another week or 2 after that, at least, to start to drop down.
I'm wondering if you can share with us just how this pandemic, especially with this recent Omicron variant, has put that strain on the medical staff that works in these hospitals. Because I think oftentimes we're looking at these hospitalization numbers, and you had mentioned this earlier, they're not confined to COVID cases. There are still so many other things that are happening in our community that happened before this pandemic. What has that been like, just the overall strain on the hospital staff in order to treat a variety of things? You know, is there a specific area for just COVID-19? Are there certain individuals who are assigned to other sorts of treatments? I mean, I'm just imagining that it could be a strain, knowing that there could be a wide variety of things that people are coming in for.
Yeah, I think you're absolutely right. This has not been an easy period of time. And we did have, a little breather after Delta and thought things were better, and then Omicron came. And that's been true throughout the pandemic. We've had periods where we've been crazy busy, really intensely busy, and then periods where it gets a bit more settled. I think, again, this is what we sign up for in healthcare, right? So we're here to care for folks that need care. What we worry about more at HPH is that people will rise to the occasion when the occasion warrants it, right? So right now, people will do more work for more hours, more days shift than they would otherwise potentially choose to. It's when things settle back down again and people realize just how tired they are, or how this experience has affected them, that we're concerned about. And so we are trying very hard to put into place a lot of supports for our employees so that as things begin to be less busy, we actually can support them and we can make sure that they recover and are ready for whatever the next challenge is.
I'd like to always ask, doctors and medical experts how they navigate this for themselves. I'm interested to know, do you go to restaurants? Do you go to pauhanas? How are you making these decisions for yourself? Because that can kind of inform us, I think, as to what we should be doing. How do you gauge risk right now?
Well, I am fully vaccinated and boosted. I wear a double mask, as I described to you, and I carry on my life as pretty much usual. I have never been one for large gatherings that among, people that I don't know well. So I mostly am with people that I know. and have, small gatherings at my house or go to small gatherings. But and I do try to support restaurants with takeout as much as possible, and then occasionally we will actually go and have a meal out. So I just try. I think you're always looking at risks and benefits, and mental health benefits are important. And so making sure that although we have to physically distance in certain circumstances, we don't socially distance, right? So I think maintaining that social network is really important.
As we continue to see these numbers, and you say that we could be we could be plateauing here. What is your message, I guess, generally to the community right now? I think there is still a lot of sticker shock, if you will, when we continue to see these numbers, 3,000, 4,000 cases, and people are still very worried about where we're at right now as a community. What is your overall message when we're looking at this and putting into context of where we're at?
I think it's going to be really hard for people in Hawaii to believe that we're through it and that we can relax and be a little bit more willing to socialize and go to sporting events and all of that kind of thing. I think, we have been quite conservative throughout the pandemic. When I have gone to other states and experienced what their life is like, it's not like here. People are not wearing masks in the same way and are not as worried about it, and are not talking about COVID all day long either. And so I think our challenge is going to be to get to a point where we feel like, yes, the numbers have come down. Yes, we can believe that we're at least in a good place for a period of time. Whether there's something more coming, there probably is, and we'll deal with that when it comes. But I think trying to recover a little and be confident that we can be safe for a while, I think is going to be really important. I know there are families where grandparents haven't seen grandkids in this entire period of time. There are all kinds of those sorts of stories. And I think there will be a point where we need to try to come through that and begin to behave more normally compared to what we used to.
I'm looking forward to that reconnecting. I want to give you a chance. I know that we're almost out of time, but to talk a little bit about boosters and availability and what you would tell people about that, because our booster rate, while our 2 shots are pretty good, our 3 shots are not nearly where they ought to be.
Yeah, that's true. And I mean, the data just keeps coming in. The CDC has 3 recent new studies that show that if you are due for a booster, so 5 months after your second either Pfizer or Moderna shot, you need to get that booster. It adds significant protection to your risk of illness with Omicron. And so if you're in that up-to-date period where it's not yet been 5 months, then you're okay. But make sure you make that appointment for that dose at 5 months. If you receive J&J vaccine, then it's a 2-month booster, or you could choose to also switch over to an mRNA vaccine as well instead. So, and boosters are available lots and lots of locations. There's no difficulty, I think, finding a site to get a vaccine.
Okay, Dr. Melinda Ashton from Hawaii Pacific Health, thank you so much again for joining us and for sharing those insights. It's always a joy and pleasure talking to you.
Thank you very much.
Thank you. Aloha.
Thank you. Well, great to hear from her, especially with her knowledge about children, given that she is a pediatrician, and some, I would say, cautious optimism that you heard there, that the hospitals are holding steady. They're not seeing the rate of people rushing in the way that they did even 7 to 10 days ago, especially of those people wanting tests. She said that, even 3 more days of data from the last time we spoke to Dr. Char, by her estimation, we are plateauing and perhaps even declining, which is such good news there. But she did, of course, encourage boosters and encouraging folks that if you don't have access to a KN95, to consider using the surgical mask and the cloth mask together, doing that double mask, which a lot of folks have access to when the KN95s are so hard to find.
Yeah, and we're seeing a lot of that in the community as people are doing that masking. But she's also expressing that, if you are outdoors, that there is a lot more, you can be a lot more safe and not maybe as cautious, and that people who are outdoors and not in a large gathering or on others can feel free to take those masks off, that it is not necessary. But we also got an update about just the overall strain, of course, that this has had on the hospital staffs and the working personnel through the various hospitals of Hawaii Pacific Health and the medical community at large, saying, that she used the term, the great resignation, that many people have decided that this simply isn't for them. Fortunately enough that they have gotten support from FEMA and other medical support staff that has come in from the mainland. But one thing that she said that the Hawaii Pacific Health is trying to do is ensure that they continue to support their employees after this last surge, because that could often lead to people reevaluating maybe if this is the field for them, knowing the strain that they've been under for the last 2.5 years.
Yeah, I also really interesting to know what she said about kids and long COVID. We've talked about long COVID on this program quite a bit, but not necessarily in children. And she's saying that that can present in kids feeling more tired than they used to, perhaps not being able to pay attention, not engaging in sports as easily, and just general fatigue. That is worrisome. And she says it's too early to tell if Omicron will, lead to the same results, but they do expect that there will be some long COVID with Omicron, but again, just too early to tell. We are going to be switching gears and moving back to politics, but politics and the pandemic, because they are hard to separate. On Wednesday, we'll be talking to Governor David Ige. He just delivered his State of the State. I know that Ryan, you and I were watching it, and at the end, it was very interesting. He got really choked up there.
Yeah, the governor providing his last State of the State address. Of course, he's held the seat for now going on 8 years. And you could hear a little emotion from a governor that's usually pretty stoic, doesn't show a lot of emotion either way. It was rare to see that emotional side of the governor as he closed out his speech. But we'll be looking forward to speaking to him about his agenda moving forward, what he's proposing to the state legislature in terms of specific programs that he has laid out in his speech. We'll also get an update on things that are happening with the pandemic, if we can expect any changes to any policies. All of that will be happening with the governor on Wednesday here at 10:30. We hope you tune in. Until then, stay safe and aloha.
Aloha.
This episode of Spotlight Hawaii is brought to you by Longstrugs and Beachside Roofing.